Liaison Psychiatry, Module 2. Question number 31. Mrs. Y is a 27-year-old pregnant lady with a history of low mood and elated mood, requiring treatment, and is currently euthymic. What is the risk of her relapse postpartum? A. 10%, B. 20%, C. 30%, D. 40%, E. 50%. In terms of postpartum risk, usually depression occurs during the first 3 months following childbirth. The risk of relapse is 50% in people with history of bipolar disorder. The risk of relapse is about 50 to 90% with previous history of postpartum psychosis. In the scenario given here, this person has history of bipolar disorder in the past. Therefore, the risk of relapse is 50%. Answer for question number 31 is E, 50%. Question number 32. Postnatal depression occurs in what percentage of women after childbirth? A. 1 to 5%, B. 5 to 10%, C. 10 to 15%, D. 20 to 25%, E. 40 to 50%. Postnatal depression occurs in 10 to 15% of women after childbirth. The peak period is usually 3 to 4 weeks following childbirth. Usually it occurs within 6 months postpartum. The correct answer for 32 is C, 10 to 15%. Postnatal depression occurs in 10 to 15% of women after childbirth. Question number 33. Which of the following statements is true of postnatal depression? A. It occurs within 4 to 6 days of childbirth. This statement is not true because baby blues usually occurs within 2 to 3 days after childbirth. B. It occurs in 10 to 15% of women after childbirth. That is the correct statement. Let's look into the other options. C. It is more likely in a woman from lower social class. There is no association for this. D. It is more likely in women who have an assisted delivery. Again, there is no association and no study to support the statement. E. It is more likely in older mothers. This is also a false statement. Therefore, the correct statement is B. Postnatal depression occurs in 10 to 15% of women after childbirth. Answer for 33 is B. Question number 34. Mr. Y has been treated for multiple sclerosis and he developed depression following treatment. Which of the following drugs is most likely to have induced the depression? A. Baclofen, B. Amantadine, C. Beta interferon, D. Tizanidine, E. Glatiramir acetate. The medications which are used for treatment of multiple sclerosis can sometimes induce depression, particularly beta interferons and in some cases alpha interferons. Both these are associated with depression. Therefore, standard care involves assessment of depression in all patients who are diagnosed with multiple sclerosis, and if they have a past history of depression, then prophylactic antidepressants are recommended in such cases. The answer for question number 34 is C, beta interferons. 35. Ms. Y is a 24-year-old woman recently diagnosed with debilitating symptoms of premenstrual syndrome. The drug of choice for treatment of her condition is A. amitriptyline, B. fluoxetine, C. reboxetine, D. duloxetine, E. mirtazapine. For the treatment of premenstrual syndrome, two most studied SSRIs are fluoxetine and sertraline. Most effective is fluoxetine with a response rate of 60 to 90%. Interestingly, these drugs are effective within one menstrual cycle, which is within few days. That's too rapid for antidepressant effect. Intermittent dosing during the luteal phase of the menstrual cycle is also effective. Luteal phase refers to 2 weeks prior to the menses. Answer for question number 35 is B, fluoxetine. Fluoxetine is a drug of choice for treatment of premenstrual syndrome. 36. A 46-year-old lady has been treated on tamoxifen for breast cancer. She is also clinically depressed and will need treatment with antidepressants. Which one among the following should be avoided due to its effects upon tamoxifen? A. Duloxetine, B. Venlafaxine, C. Mirtazapine, D. Amitriptyline, E. Moclobemide. Tamoxifen is used for the treatment of breast cancer. When tamoxifen is combined with CYP2D6 inhibitors, the following drugs are examples of CYP2D6 inhibitors, which includes duloxetine, fluoxetine, paroxetine, and bupropion. So when tamoxifen is combined with any of these medications, then there is reduction in circulating levels of endoxifen levels in women. Therefore, they should not be combined and used together. Answer for 36 is A, duloxetine. Duloxetine should be avoided due to its effects upon tamoxifen. Question number 37. Modafinil, which is used for daytime sleepiness, causes which of the following neurochemical changes? A, release of serotonin, B, release of dopamine, C, blockade of orexin release, D, inhibition of lateral hypothalamus, E, sustained plasma levels for 24 hours. Modafinil is a stimulant which is used for daytime sleepiness. What it does is it enhances release of dopamine. So this is pre-drug status and this is post-modafinil status. So if you look at the post-modafinil status, it enhances release of dopamines. Therefore, the answer for question number 37 is B. Release of dopamine is one of the neurochemical change which is seen following ingestion of modafinil. Question number 38. The rate of spontaneous congenital malformations associated with pregnancy is A. 15 to 20%, B. 1 to 1.5%, C. 2 to 3%, D. 10 to 12%, E. 30 to 35%. With regards to malformations, the risk of spontaneous major malformation is 2 to 3% of all pregnancies. But when drugs are taken during pregnancy, the risk is increased. 5 out of every 100 malformations occur due to drugs. The answer for 38 is C, 2 to 3%. The rate of spontaneous congenital malformations associated with pregnancy is 2 to 3%. 39. The most sensitive period for fetal malformations on exposure to teratogenic drugs in pregnancy is A. 2 to 14 weeks, B. 14 to 28 weeks, C. 28 to 32 weeks, D. 32 to 36 weeks, E. at labor. The most sensitive period for fetal malformations on exposure to teratogenic drugs is usually the first trimester. The first 6 weeks are very important. Organogenesis takes place between 17 to 60 days. These are very sensitive period. So the first trimester is a very sensitive period for fetal malformations. Therefore, the answer for question number 39 is A, 2 to 14 weeks. Question number 40. Which of the following effects on the fetus is not associated with the mother being treated with SSRIs during pregnancy? A. Spontaneous abortion, B. Reduced birth weight, C. Premature birth, D. Neural tube defects, E. Neonatal irritability. Among the options given here, spontaneous abortion, reduced birth weight, premature birth, and neonatal irritability are all features reported when a mother is being treated with SSRI during pregnancy. But neural tube defects is not heard of. Question number 41. What is the relative risk of developing Epstein's anomaly in child when mother is on lithium during pregnancy? A 2.5, B 3.5, C 5.5, D 7.4, E 9.5. In terms of Epstein's anomaly, the maximum risk is at 2 to 6 weeks after conception. Relative risk compared to general population is 10 to 20 times higher, but the absolute risk is low at 1:1000. The absolute spontaneous risk of developing Epstein's anomaly is 1 in 20,000, but when lithium was taken during the first trimester, the absolute risk is now 1:1000. Therefore, relative risk compared to general population is 10 to 20 times higher. So 20,000 divided by 1000 is 20. So the risk is increased 10 to 20 times. The nearest answer to 10 is 9.5. So this has to be marked. Question number 41, answer is E. Question number 42. If a patient continued to take sodium valproate throughout her pregnancy, what is the risk of the baby having neural tube defect? A 1 in 10, B 1 in 100, C 1 in 1000, D 1 in 10,000, E 1 in 100,000. Sodium valproate is the most teratogenic among all the psychotropic drugs used. The risk for any birth defect quoted is 7.2% in Maudsley's and also NICE guidelines. North American registry quotes 10% risk. The risk of neural tube defects is 1 to 2%, but the child can also develop congenital anomalies like digital and limb defects, heart defects, etc. So the risk of neural tube defect is 1 to 2%. So the correct answer is 1 in 100. B is the correct answer. Question number 43. If a patient continued to take sodium valproate throughout her pregnancy, what is the risk of the baby having any birth defect? A 1 in 10, B 1 in 100, C 1 in 1000, D 1 in 10,000, E 1 in 100,000. So the question here is slightly changed. What is the risk of the baby having any birth defect? So in terms of any birth defect, there is a 10% risk, 10% risk, which is 1 in 10. So correct answer for A is 1 in 10. Risk of baby having any birth defect is 1 in 10. The risk of baby having a neural tube defect is 1 in 100. Answer for 43 is A, 1 in 10. Question number 44. The antidepressant with favorable evidence for use in postpartum breastfeeding mother is A. Desipramine, B. Trazodone, C. Citalopram, D. Sertraline, E. Duloxetine. In terms of Maudsley's recommendation for breastfeeding mothers, the antidepressants recommended are paroxetine or sertraline. The antipsychotics recommended include sulpiride or olanzapine. Mood stabilizers, avoid them if possible. Valproate can be used if it is absolutely essential. In terms of sedatives, we can use lorazepam for anxiety and zolpidem for sleep. The antidepressants recommended are either paroxetine or sertraline. Question number 44. The answer is D, sertraline. Question number 45. Which of the following is not a feature of transient global amnesia? A. intact sensorium, B. anterograde amnesia, C. temporal hyperperfusion, D. associated with focal neurological deficits, E. complete resolution. Let's look into some of the features of transient global amnesia. So in transient global amnesia, the person must have clear-cut anterograde amnesia during the attack. There is no loss of consciousness, there is no loss of personal identity, but the cognitive impairment must be limited to only amnesia. There is no aphasia, no apraxia, all these things. There is also no accompanying focal neurological symptoms during the attack. The attacks must resolve within 24 hours. It usually occurs due to hypoperfusion in both the temporal lobes of the brain. So question number 45. Which of the following is not a feature of transient global amnesia associated with focal neurological deficits? There are no focal neurological deficits present in transient global amnesia. Sensorium is usually intact. They will have anterograde amnesia. There is temporal hyperperfusion, and complete resolution occurs within 24 hours. So, and correct answer is D. Focal neurological deficits is not a feature of transient global amnesia. Question number 46. A 75-year-old man with Parkinson's disease develops psychosis unrelated to levodopa use. Choose the best antipsychotic. A. aripiprazole, B. risperidone, C. olanzapine, D. quetiapine, E. haloperidol. Quetiapine is recommended for treatment of Parkinson's disease psychosis. If patients do not respond to quetiapine, then clozapine can be used. These drugs are least likely to cause extrapyramidal side effects, and they do not worsen the motor symptoms of Parkinson's disease. Question number 46. Answer is D. quetiapine. 47. Huntington's disease shows the following pattern of inheritance. A. autosomal dominant with high penetrance, B. autosomal dominant with poor penetrance, C. autosomal recessive, D. X-linked dominant, E. X-linked recessive. What is penetrance? Penetrance refers to the proportion of individuals with mutations who actually exhibit clinical symptoms. When you say 90% penetrance, then it means 90% of people with mutations will develop the disease and the clinical signs and symptoms. Huntington's disease is one condition which is autosomal dominant and has got high penetrance. So 47, answer is A. Huntington's disease shows autosomal dominant pattern of inheritance with high penetrance. Question number 48. Research and investigations into sleep disorders have suggested that A. hypocretins are different from orexins, B. there is an HLA association with REM sleep behavior disorder, C. sleep latency of more than 10 minutes on overnight polysomnography is characteristic of narcolepsy, D. clonazepam is the first line treatment for narcolepsy, E. REM sleep behavior disorder can precede future movement disorders. Let's quickly see the features of narcolepsy. The prevalence is 0.025%. Symptoms of narcolepsy include excessive daytime sleepiness, sudden sleep attacks, cataplexy, sleep paralysis, and hypnagogic hallucinations. Only 10% of individuals present with all four phenomena described above. Narcolepsy is either familial or sporadic. There is strong association with HLA DQB10602 marker in almost all individuals regardless of ethnicity. In narcolepsy, there is abnormally low concentration of hypocretin 1. Hypocretin 1 is also called as orexins A, and this is noted consistently in CSF analysis. When you do sleep polysomnogram, there is sleep latency of less than 10 minutes. Sleep onset rapid eye movement periods reported. The multiple sleep latency test is also helpful in supporting the diagnosis of narcolepsy. Stimulants such as methylphenidate or modafinil can be used. Imipramine may also have effect against cataplexy. Let's see some important features of REM sleep behavior disorder. In this condition, patients act out their dreams with limited awareness of surroundings. They may become violent or have dangerous consequences that result in physical harm. It occurs during middle to later third of the night during REM sleep. It is associated with disorders like Parkinson's disease, Lewy body disease, Guillain-Barré syndrome, etc. It precedes the diagnosis of movement disorder by several years. So REM sleep behavior disorder precedes the diagnosis of a movement disorder like Parkinson's disease by several years. Lesions are mostly seen in the brainstem. Clonazepam is a very effective drug used for treatment of REM sleep disorder. Making the sleep environment safe is also a first-line measure recommended for people with REM sleep behavior disorder. So if you look at the options for 48, hypocretins are different from orexins. That is false. Both are actually same. B, there is an HLA association with REM sleep behavior disorder. That is false. There is an HLA association with narcolepsy. C, sleep latency of more than 10 minutes on overnight polysomnography is characteristic of narcolepsy. That is false. It's sleep latency of less than 10 minutes on overnight polysomnography is characteristic of narcolepsy. D, clonazepam is a first-line treatment for narcolepsy. That is false. Clonazepam is a first-line treatment for REM sleep behavior disorder. E, REM sleep behavior disorder can precede future movement disorders. That is the correct answer. 48 answer is E. 49. A woman who has had herpes encephalitis develops severe carbohydrate craving, weight gain, and inappropriate sexuality. Which of the following is the most likely diagnosis? A. Cushing syndrome, B. Diabetes mellitus, C. Hypothyroidism, D. Kluber-Bucy syndrome, E. Prader-Willi syndrome. Let's see the features of herpes simplex encephalitis. Herpes simplex encephalitis is the most common cause of Kluber-Bucy syndrome in human beings. Kluber-Bucy syndrome is characterized by emotional blunting, hyperphagia, visual agnosia, and inappropriate sexual behavior. The person may have bilateral temporal lobe damage, and most often only a partial syndrome is actually evident. Carbamazepine may be used to control some symptoms of Kluber-Bucy syndrome. So if you look at the slide, this patient had herpes encephalitis and he developed carbohydrate craving, weight gain, and also inappropriate sexual behavior. All these are features of Kluber-Bucy syndrome. Answer for 49 is D. Question number 50. An infarct in which of the following regions of the brain is most likely to result in depression? A. Occipital lobe, B. Basal ganglia, C. Medulla, D. Cerebellum, E. Parietal lobe. Usually, if there is a lesion or infarct involving the basal ganglia, then patients can develop mood symptoms, particularly depression. Question number 50, the answer is B, basal ganglia. An infarct in basal ganglia of the brain is most likely to result in depression. 51. Which of the following patients is at the highest risk of suicide? A. 16 years old single unmarried social class 1, B. 35 years old single unemployed social class 5, C. 60 years old widowed man social class 5, D. 30 years old woman part-time employed social class 1, E. 44 years old father of 2 children in a heterosexual relationship. In terms of age, older people are at highest risk of suicide. So age factor in C is a risk factor. Then Widowed men. Widowed men are more likely to engage in suicidal behavior as opposed to married men, and lower social class is also another risk factor. So the correct answer for C, the correct answer for 51 is C. 60 years old widowed man, social class 5, is at the highest risk of suicide. Which one of the following is associated with a clinical picture of schizophrenia-like psychosis? A. Tourette syndrome. B. Huntington's disease. C. Heroin use. D. Panic disorder. E. Myasthenia gravis. In Huntington's disease, the prevalence of psychiatric symptoms is about 30% of cases. For 3 to 6% of cases, the first presentation is usually in the form of schizophreniform psychosis. Therefore, question number 52, the correct answer is B. Huntington's disease is associated with a clinical picture of schizophrenia-like psychosis. Question number 53, the male-female ratio of hypothyroidism is A. 1:6, B. 1:2, C. 4:1, D. 10:1, E. 1:1. The correct answer is A. 1:6. Females are at higher risk of developing hypothyroidism. Therefore, the male-female ratio is 1:6. Question number 54. A 33-year-old man is suspected to have various sexually transmitted illnesses and possibly HIV. He presents with cognitive impairment. Which of the following cells in his brain are least likely to be directly affected by HIV? A. Neurons. B. Microglia. C. Macrophages. D. Lymphocytes. E. None of the above. If you look into the neuropathogenesis of HIV, there is formation of microglial nodules. There is also infiltration of macrophages and also involvement of lymphocytes. But neurons are least likely to be directly affected by HIV. The answer for 54 is A. Neurons. Question number 55. A 34-year-old homosexual man presents with forgetfulness, loss of concentration, mental slowing. He admits to unsafe sexual practices. He appears clumsy and apathetic. Which of the following statements is false with regards to his diagnosis? A. Decline in memory may not be severe enough to impair all ADLs. B. Decline in motor function may be present. C. Minimal duration of symptoms must be 1 year to make the diagnosis. D. Aphasia, agnosia, and apraxia are unusual. E. Laboratory evidence of HIV infection is necessary to make the diagnosis. If you look at the AIDS dementia complex, the person may have cognitive disturbances, motor disturbances, and behavioral disturbances. 15% of people who have AIDS dementia complex go on to develop dementia, and the type of dementia that they develop is subcortical type of dementia, with mental slowing being a characteristic feature. The decline in memory may not be severe enough to impair all activities of daily living skills. Normally, when somebody has got dementia, their ADL skills may be affected, but in this condition, the decline may not be severe enough to impair all the ADLs. The minimum duration should be 1 month to make a diagnosis. Aphasia, apraxia, and agnosia are unusual. Okay. There should be also laboratory evidence of HIV infection. So, among the statements, decline in memory may not be severe enough to impair all ADLs, that is correct. Decline in motor function may be present, that is correct. The minimum duration of symptoms must be 1 year to make the diagnosis. This is the false statement. It is usually 1 month to make the diagnosis. Okay. So answer for 55 is C. Question number 56. Which of the following is a helpful sign in distinguishing non-epileptiform attack disorder from epilepsy? A. Raised post-ictal prolactin. B. Presence of post-ictal confusion. C. Tongue biting. D. Resistance to eye opening. E. Pelvic thrusting. If you look at the options, Raised post-ictal prolactin is seen in epilepsy. Presence of post-ictal confusion is also seen in epilepsy. Tongue biting is a feature seen in epilepsy, and pelvic thrusting is also seen in epilepsy. Resistance to eye opening is a feature seen in non-epileptiform attack, also called as pseudo seizures. Answer for 56 is D. Question 57. A 70-year-old gentleman suffers from Parkinson's disease and is also currently depressed. His wife says he has been sending her sexually explicit texts and also accused her of having an affair. This is a new type of behavior and is out of keeping with his previous pattern of behavior when depressed. Which drug is most likely to account for this presentation? A. Propranolol, B. Ropinirole, C. Diazepam, D. Duloxetine, E. Dothapine. Ropinirole is one of the drugs used for the treatment of Parkinson's disease. It produces the same effect as dopamine. Therefore, when some patients take ropinirole, there is increase in their libido and they also display hypersexual behavior. So the most likely offending drug in this situation is ropinirole. Answer is B. Answer for 57 is B, ropinirole.